Parkinson's disease is a brain disorder that causes problems with movement, balance, and coordination. It happens when certain nerve cells in a part of the brain called the basal ganglia die or become impaired. These nerve cells normally produce a chemical called dopamine, which helps transmit signals between different parts of the brain that control movement. When dopamine levels decrease, the brain cannot send the right messages to the muscles, resulting in tremors, stiffness, slowness, and other symptoms. Causes of Parkinson's disease. The exact cause of Parkinson's disease is still unknown, but scientists believe it may involve a combination of genetic and environmental factors. Some people may inherit mutations in certain genes that increase their risk of developing Parkinson's, while others may be exposed to toxins or infections that trigger the disease. However, most cases of Parkinson's are sporadic, meaning they occur randomly without a clear cause. Symptoms of Parkinson's disease. The symptoms of Parkinson's disease vary from person to person and usually develop gradually over time. They can be divided into two categories: motor symptoms and non-motor symptoms. Motor symptoms are symptoms that affect movement, and they include tremor, which is shaking or trembling of a limb, usually the hand or fingers, that occurs when the limb is at rest and may improve when performing tasks. Rigidity, a stiffness or tightness of the muscles that can cause pain and limit the range of motion. Bradykinesia, a slowness or difficulty in initiating and completing movements that can make simple tasks such as walking, dressing, or eating challenging. Postural instability, a loss of balance or tendency to fall that can result from impaired reflexes or coordination. Non-motor symptoms, on the other hand, affect other aspects of health and well-being and include depression. The patient may have feelings of sadness, hopelessness, or loss of interest in activities that can affect mood, energy, sleep, and motivation. Anxiety, a feeling of nervousness, worry, or fear that can cause panic attacks, phobias, or social withdrawal. Cognitive impairment. The patient may have a decline in memory, attention, reasoning, or problem-solving skills that can affect daily functioning and communication. Sleep disorders. A difficulty in falling asleep, staying asleep, or having a restful sleep that can cause daytime sleepiness, fatigue, or insomnia. Constipation. A difficulty in passing stools that can cause abdominal pain, bloating, or nausea. Fatigue. A feeling of tiredness or lack of energy that can affect physical and mental performance. Diagnosis of Parkinson's disease. The diagnosis of Parkinson's disease is based on a combination of medical history and a physical examination. There is no specific test that can confirm Parkinson's disease definitively, but the doctor may order some tests such as blood tests or imaging tests such as MRI or CAT scans. Also, genetic tests may be used to rule out other conditions that can cause similar symptoms. Treatment of Parkinson's disease. The treatment of Parkinson's disease aims to improve the quality of life by reducing the symptoms and complications of the disease. There is no cure for Parkinson's disease yet, but there are several medications that can help restore dopamine levels in the brain and improve motor function. Some examples are levodopa, dopamine agonists, which are drugs that mimic dopamine, and MAOB inhibitors, which are drugs that prevent dopamine breakdown. However, these medications may have side effects such as nausea, drowsiness, hallucinations, involuntary movements, or impulse control disorders, which may lead to gambling or compulsive shopping. Another option for some people with Parkinson's disease is deep brain stimulation, DBS, which is a surgery that involves implanting electrodes in specific areas of the brain that control movement. These electrodes are connected to a battery-operated device called a neurostimulator that delivers electrical impulses to the brain that can help reduce symptoms. At the end, it's important to remember that Parkinson's is a complex disease, and each individual's experience with the condition is unique. So, if you have any of the symptoms of Parkinson's disease, talk with a doctor immediately.